Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the first section of Module 2, we will explore taking a clinical question, narrowing its focus, and formulating a clear hypothesis, or testable idea. In this module, we will discuss how to create a more focused clinical question, which will influence your research methods. Distinguish between quantitative and qualitative approaches to research. Present a hypothesis, or testable idea, as a prediction. Look at ways to generate specific, measurable outcomes, as well as identify variables to consider when using an interpretive analysis. And discuss the implications of these concepts as they relate to the Stanford EBP model. Your clinical question will often begin broadly. For example, why have we been administering the same procedure for so long? You may follow this broad inquiry with something a bit more specific, such as, what variables come into play when we administer this procedure? After which you could more pointedly ask, which particular variables could we measure to estimate their influence on patient care? Once you have focused your clinical question, it will be critical to think about your methods and outcomes, which typically come in two varieties, quantitative and qualitative. Quantitative research is the investigation of phenomena that uses precise measurement to yield data that are subjected to statistical analysis. It is a formal, objective, systematic process to describe, test relationships, and examine cause and effect interaction among variables. Qualitative research is an inductive, in-depth investigation of phenomena in a holistic fashion that uses a flexible research design. The qualitative researcher seeks to answer questions that focus on the social experience, how it is created, and the meanings that are applied to it. You may be wondering exactly when to use a quantitative versus a qualitative approach. The answer depends on several factors, some of which this table enumerates. First, if you want to quantify and generalize your study results, then you should use a quantitative approach. If you want to understand people's reasons, opinions, motivations, beliefs, or life experiences, then you should opt for a qualitative perspective. If you want to study a larger sample of subjects, typically at random, then you should choose a quantitative approach. If you want to study a smaller sample, typically until you reach saturation, then you should opt for a qualitative perspective. And if you want to analyze your data statistically, to make inferences about a larger subject population, then you should choose a quantitative approach. If you want to analyze your data non-statistically, then you should opt for a qualitative perspective. Now that we've touched on general methods, let's consider our first quantitative example. We want to know if changing a given protocol in a cardiovascular unit will have any effect on patients' blood pressure. To make the question narrower, we could further consider the range of variables at play in this situation. That is, which factors could contribute to increases or decreases in blood pressure. As a final step, we could ask more specifically about the influences of two variables, sodium intake and physical activity, and how a decrease in one and an increase in the other could lead to changes in blood pressure. Before moving on, let's talk about two concepts often involved in answering a clinical question. The first concept is that of a theory. A theory is an idea or a set of ideas that is intended to explain facts or events. You may think of a theory as a general framework for explaining a given set of observations. The second concept is that of a hypothesis. A hypothesis is a tentative assumption made in order to draw out and test that assumption's logical and empirical consequences. That is, it's an assumption to address your question. A hypothesis is frequently used to make predictions about a clinical question, and may be used to support a theory, though this is not always the case. To extend on this last point, you may think of a hypothesis as a prediction of an outcome given other variables. If we do X, then we expect that Y will happen. In the case of our first clinical question, we expect that decreased sodium intake and increased exercise will lead to reduced blood pressure. This would be compared to patients who maintain their usual diet and exercise habits. In the next section of this module, we'll discuss how to develop measurable outcomes for this hypothesis. But first, let's consider two more clinical questions. In this second quantitative example, we want to know if changing a patient's exercise routine will have any effect on pulmonary function. To make the question narrower, we could further consider the influence of different types of exercise. That is, do different types of exercise contribute differently to changes in pulmonary function? As a final step, we could ask even more specifically whether varying two exercise types could lead to short and long-term changes in pulmonary function. Remember, you may think of a hypothesis as a prediction of an outcome given other variables. If we do X, then we expect that Y will happen. In this case, we expect that having patients carry out a progressively challenging exercise regimen will lead to greater pulmonary function. This would be compared to patients who carry out a more static exercise routine. Later, we'll discuss how to develop measurable outcomes for this hypothesis. Before that, however, let's consider our last clinical question. In this qualitative example, we want to better understand the experiences of family caregivers and how these caregivers work in collaboration with healthcare professionals in regards to chronic illness. To make the question narrower, we could consider a range of chronic illnesses. That is, which illnesses might have a more pronounced influence on the experiences of family caregivers and their interactions with healthcare professionals. As a final step, we could ask more specifically about caregivers' experiences and collaborations when treating patients with lymphoma. In the next section of this module, we will discuss options for interpretive analysis as it relates to this clinical question. Now I'll ask you to reflect on what you've learned. What is a key methodological aspect of quantitative research? A key feature of quantitative research is statistical analysis, compared to interpretive analysis in qualitative research. To focus your clinical question, you typically decrease or increase the number of variables you study. Typically, to focus your clinical question and to identify the most important clinical factors, you'll decrease the number of variables you study. True or false, empirical evidence is based on someone's strong belief about something. The answer is false. Empirical evidence is based on the data you collect or that other clinicians have collected. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed the first section of Module 2.